This is the audience.
Hi, my name is Christy Moore. My speech today is on post-traumatic stress disorder, which is also known as PTSD. I want to inform and educate my audience on the specific causes and symptoms of the post-traumatic stress disorder, PTSD. I personally suffer from PTSD on a daily basis due to a tragic death in my family. And I have done a lot of research on the disorder, and I struggle with it daily. I've dealt with flashbacks and avoidance until I got the help that I needed. Let's first begin by understanding what post-traumatic stress disorder, PTSD, and who does it PTSD affect. The cause of post-traumatic stress disorder, PTSD, is a mental health condition caused by a traumatic or a terrifying incident that has happened to you that you have witnessed, which are referred to as stressors. What causes these stressors could be a death of someone close to you, or a violent crime against you, or witnessed by you, child abuse, rape, natural disaster, a car accident, or war. The cause is also based on the severity of the trauma. What does PTSD affect? The person who has it, families, work relations, and the community as a whole. It is more identified today with military servicemen and women due to serving in the military and war-related areas of the world. Every day people can be diagnosed. How it affects family members. They may feel alienated and discouraged because your loved ones have not been able to overcome the effects of the trauma. Family members frequently devote themselves totally to those they care for, and in the process neglect their own needs. Post-traumatic stress disorder, also called PTSD, does not only affect soldiers of war. PTSD is a mental health condition that is triggered by a traumatizing event, either experienced or witnessed. Post-traumatic stress disorder, also known as PTSD, is among only of a few mental disorders that are triggered by a disturbing outside event. Although the disorder must be diagnosed by a mental health professional, you have to be suffering from PTSD symptoms for 1 month before being diagnosed with the disorder. PTSD can affect children and adults between the ages of 3 and 60 years old. The symptoms of PTSD is clearly defined as negative changes in thinking or mood, changes in emotional reactions, irritability, angry outbursts, or aggressive behavior. Self-destructive behavior such as drinking too much, trouble sleeping, concentrating, being easily startled or frightened, suicidal. They can interfere with one's ability to function daily. PTSD symptoms are generally grouped into 4 types. The first is intrusive memories. Intrusive memories is reliving the event, also called re-experiencing symptoms. You have nightmares and flashbacks. The second is negative changes in thinking or mood, or changes in emotional reaction. Also, a negative change in beliefs and feelings. You may not have a positive or loving feeling towards other people and may stay away from relationships. The third is avoidance. You avoid situations or people that trigger memories. You also avoid talking and thinking about the event. Avoidance can be one of the most dangerous parts of the disorder for the person with it because they don't seek help and it gets worse. The fourth and final is feeling keyed up. You feel jittery and nervous. Also alert and looking out for danger. It causes trouble with sleeping and trouble with concentration. It is important to know when to get treatment for PTSD. There are good treatment for post-traumatic stress disorder. When you have PTSD, dealing with the past is hard. You may find help in talking to a therapist. PTSD can last for 1 month or a lifetime. When do you get treatment for PTSD? When you experience avoidance. It is one of the most dangerous parts of this disorder. Or when your life feels out of control, or you have bad thoughts, uncontrollable anxiety, no interest in life, or maintaining relationships. How do you get treatment for PTSD? Contact mental care professionals, suicide hotlines, a family member, or a pastor. There is also self-help by finding a way to cope with it through some kind of activity to get your mind off of it. Try exercising, jogging, rock climbing, or any activity that interests you. What kind of treatment is there for PTSD? There is cognitive therapy, which is your therapist helps you understand and change how you think. There's also exposure therapy. A therapist helps you have less fear of your memories. There's also family therapies. PTSD does not affect your whole family. It affects your whole family, so getting help as a family is important. And there's also group therapy. People may want to talk about their trauma, and there is also medications that can help you feel less sad or anxious. Let's review. Post-traumatic stress disorder, PTSD, is a mental illness triggered by a traumatic event that has happened in your life. PTSD symptoms can be serious, so it's important to recognize them. If you know someone that suffers from this, and make sure that they get the help they need. Post-traumatic stress disorder, PTSD, just know it's not your fault. It's nobody's fault that you are suffering from this. Some people might not even know that they suffer from this disorder.